Hi, this is Patricia and Rapid NCLEX. So at Rapid NCLEX, our main aim is to assist you in your NCLEX journey from start to finish. If you are seeking to start your credential evaluation, learn and pass your NCLEX exam with no difficulty, you can just DM us and we will take you from start to finish. Let's talk about our main topic for today, which is heart failure. So when we say heart failure, it means that the heart has failed to perform its normal function. I keep saying that for your NCLEX exam, before you treat any topic, you should know the normal function of that specific organ. Now, what is the main function? Let's talk about a little physiology about the function of the heart, okay? So we know that the heart is located in the mediastinum and it's made up of 4 chambers, 2 atria at the top and then 2 ventricles at the down. Now use blood from both the superior and inferior vena cava is emptied into the right atrium. So from the right atrium, the tricuspid valve opens up and the blood is emptied into the right ventricle. From the right ventricle, blood passes through the pulmonic valve into the pulmonary system where diffusion takes place and the blood is oxygenated. This oxygenated blood then moves into the left side of the heart. So it is emptied into the left atrium. From the left atrium, the bicuspid valve will also open up and the blood is emptied into the left ventricle. Now from the left ventricle, the aortic valve opens up and blood goes into the aorta. It is from the aorta that blood is distributed to all other parts of the body. So meaning that if blood is going to the heart, it passes through the coronary artery. If it is going to the brain, it passes through the cerebral artery. And this is how the whole or all other parts of the body receives their own share of blood. In heart failure, this normal function is not there. So now, what are some of the signs and symptoms of heart failure? Before we can talk about the signs and symptoms, what are some of the causes of heart failure? So we say that patients with congenital heart diseases can result in heart failure. And then patients who have hypertension. So hypertension is our number 1 cause of heart failure. In case you are seeing this in your NCLEX exam, hypertension should be one of the causes you are going to select. It is the number 1 cause of heart failure, okay? And then also we stated that cardiac tamponade can result in that. Atrial fibrillation can also result in heart failure. Now let's do the signs and symptoms. For our signs and symptoms, we are going to group it into the left-sided and the right-sided. Okay, we said the heart has left side and then the right side. Okay, if we group it into the left-sided and then the right-sided, I think remembering it is going to be easier. So let's talk about the right-sided heart failure. We stated that used blood from superior and inferior vena cava first empties into the right atrium. So now when the right side of the heart fails, it means that there is going to be backflow of blood, meaning that the blood is going back into the system. So in right-sided heart failure, patient is going to have systemic symptoms. So we are going to see our jugular vein distension. We are also going to have ascites. There is going to be hepatomegaly. There is going to be bipedal edema, that is edema in the legs, and then there is also going to be sacral edema. So these are some of the key signs when it comes to right-sided heart failure. And then when we talk of left-sided heart failure, it is more going to be of symptoms relating to the pulmonary system. So the lungs are more affected here, and some of the signs we are going to see is autopnea, we are going to see dyspnea on exertion, okay. The patient can also have tachypnea and a dry hacking cough. Now, if we are talking about congestive heart failure, it means that it's a combination of the two. So if a patient comes and you are seeing the diagnosis of congestive heart failure, you just have to combine the left-sided and then the right-sided failure, because congestive means a combination of the two and patient is going to have both symptoms, okay. And now for our diagnosis, how do we diagnose heart failure? Our key marker here is BMP, which is the B-type natriuretic peptide, okay. That is the main marker for diagnosing heart failure. the normal value for BMP should be less than 100. So if you do a lab test and you are seeing any elevation in the B type natriuretic peptide, it means that this patient has a heart failure. Now we will have to decide, is the patient having mild, moderate, or a severe heart failure? So in mild heart failure, we will notice that our BMP level is going to be 300. And then in moderate heart failure, our BMP is going to be 600. In severe heart failure, BMP is going to be 900 and over. So let's know the normal value for BMP. These are the key things NCLEX would like to test on, okay? And then also, we stated earlier in their signs and symptoms that they are going to have an or a distended jugular vein. So it means that we'll have to do a CVP monitoring. So we'll have to check their central venous pressure. The normal central venous pressure is 2 to 8 millimeter mercury. So meaning that if we do and we are seeing an elevation in the central venous pressure, it means that the patient is also having heart failure. We can also do an echocardiography, which is going to visualize the normal function of the heart. Okay, so these are the key things when it comes to the diagnosis of heart failure. Then for our management, first let's talk about medical management. So for the medical management, the easier way for you to remember this, let's use the acronym ABCD. Okay, using the acronym ABCD is going to guide you in learning it easier. So for A, we are going to select our AC inhibitors. So AC inhibitors are indicated in treatment of heart failure. So an example, we can have the lisinopril, the pills, okay? Lisinopril is an example of an AC inhibitor. And then also the B, we are going to look. So for the B, we'll be talking about our beta blockers. So an example of a beta blocker, we can have propranolol, okay? The essence of giving beta blockers is to slow the activities of the heart. And then for C, we'll talk about calcium channel blockers. For calcium channel blockers, an example, we can have the nifedipine, yes. And then also for D, we can have digoxin. So digoxin is a cardiac glycoside and it's given to help in the contractility of the heart. And then also we can talk of diuretics. So diuretics, we can have the loop diuretic, the thiazide diuretics, okay, and then the potassium sparing diuretics, okay. Now it depends on which one you want to administer. We will talk more about these drugs into details in our next video. And then also one thing you should know is that when you're administering digoxin, we know it has a narrow therapeutic range. So drugs with narrow therapeutic range, it means that you have to check their blood levels before administering in order not to cause toxicity. Aside the medical management, our nursing management, okay, we are going to weigh our patients daily. This is very key when it comes to the NCLEX exam, because there is if we see a fluid volume overload, it means that our heart failure is worsening, and so we don't want the patient weight to exceed the normal. So we weigh the patient same day, same time every day, in the same clothes, with the same scale, okay? These are key things you should always remember for the NCLEX exam. And then their diet should be free of less salt, okay? So their salt intake should not exceed 2 grams, okay? These are key things that you always have to know when it comes to the NCLEX exam, okay? And then we can also talk about nursing them in the Fowler's position due to their difficulty in breathing. We'll have to administer their prescribed medications on time and all that. Okay, so before we complete this topic for today, I'll try and post a question on this topic. Okay, I'll post a question and then post the rationale later. Try and answer this question and it's going to help you. Thank you.